Good evening, everyone. It's Jen Freiheit on Wednesday, June 10th of 2020. I wanted to let you know that I will be presenting for 2 more weeks after this through June, and that is not an effort to minimize the communication through the rest of the county, but just wanting to make sure that we realign our communication strategy throughout the rest of this pandemic, through the rest of the year, in different directions to make sure that we're reaching our community. But we'll always be here to communicate when anything happens or anything pops up that we need to make sure that we get across. So for the next 2 weeks, next week I would like to talk a little bit more about the new direction that the health department is going in this next phase of COVID-19. I'll also have much better data and statistics next week as we will be crunching some bigger numbers this weekend, getting some new metrics from the state health department and looking at more metrics regionally. So I'll have some better data next week to share, as well as where the health department is going strategically. And then the final week, I'm hoping to share some human side stories of some things that had occurred throughout the pandemic so far that would like to wrap up with and close those out to share with you. So recently our health department did an assessment of our staff and the direction we're going, where we've been as sort of a quality improvement or performance process improvement. And I just wanted to share 2 things that really came out from the health department were, number one, the amazing teamwork that has occurred throughout the health department and throughout the county. It's really looking at the positive from what has been a drastic situation with a worldwide pandemic, is that it really pulled people together in true teamwork fashion. And it also really showed, as our staff identified, the extreme dedication to the community and how tirelessly they have worked to ensure that the community is safe. But our assessment also showed that there's been a culture shift and a change. We see less people maybe taking the pandemic as seriously, and we're also seeing an increase in distrust for healthcare and for government in general. And so that tells us we need to align our communication strategies differently. One thing that we have noticed as a weakness is how stretched thin our health department has been. But I have to thank tremendously the county HR department, the county executive and his office, and all the other county departments that have stepped up to train, to help out, to lean into this issue with the health department and really help the health department in contact tracing and taking phone calls for us and doing all of that and getting us additional staff as we cried out for some help. So it's been an amazing teamwork experience throughout the county that our entire health department is very thankful and grateful for. I think 3 of the future operations that we're looking toward in the coming months is really how we can increase testing at workplaces and how we can help businesses to get their employees all tested. We are working with DPI, the Department of Public Instruction, and awaiting their guidance that is to come very soon so that we can then increase our guidance for all of our school systems for how they can prepare with the fall start of the school year and how that might look at that time and what might be different. And we're also really looking at improving data metrics and analysis for communicable disease tracking and surveillance and reporting, so that we can certainly continue to bring even better data metrics your way as we monitor for increases in virus transmission. So I will say that our numbers have been slightly trending downward, dare I say. Keep your fingers crossed, knock on wood. But for the past week, our numbers have been slightly decreasing. And that's where I say by next Wednesday, we're always looking for that 14-day downward trend. By next Wednesday, I think we will have some much better data for you. Today, we sit at 1,315 positives and 37 deaths. And so we're certainly hoping that it continues in that direction, but we're preparing always for the worst. And we can't really say what the downward trend could be attributed to. There's so many different factors. We're still tracking and trending, and that's why we need another week to see if any of these recent peaceful protests and other mass gatherings have produced any amount of transmission. So we're watching that very closely and tracking that data. And I do have some rather discouraging news tonight. Last week, we were able to test 843 people out at Central High School through the National Guard. And with a quick ramp up at Tremper High School with the National Guard, we were able to, in 3 days' time, with very little time to advertise, test 1,078 people. The downside is that there was an error in the laboratory's ability to test 170 people that went through the Central High School site. And these people have been waiting for their test results. We have been desperately trying to take all of the phone calls and give information, but this was recently just found out today that those labs will not be run. So we are trying to work on a different testing method, and unfortunately these 170 people, I'm sort of putting the call out, will need to come back and get tested. So it has not been an acceptable error, and so we're trying desperately to find the solution. I have two solutions. One is that our Kenosha Community Health Center still has their drive-through testing site at Gateway Technical College, and you can call for a quick registration at the Community Health Center, 262-925-1325, to do a quick registration, and they will be able to get you in on Friday. And if it poses a problem to be able to do that quick registration through their phone number, you can show up on Friday and we will ensure that you get retested and taken care of at Gateway. I realize this is a problem for probably many people who live out farther west in our county to come all the way into Gateway. So we're also working with the National Guard to ramp up a very quick community testing site either Friday or Saturday, and I have not received official word yet which day it will be, but we will, I'm awaiting on that final confirmation from the National Guard, but fully expect to be able to make it happen for hopefully Friday, and we will advertise that and let people know that, again, will not just be for the 170 that had their tests botched up, but that will be, again, an open community testing site. Still hoping to look out at Central High School, and we will confirm those details and let you know. If you are awaiting your test results, it's likely because of this error, and that is why you have not received a call from the National Guard. But if you are ever not receiving your test results and you want to know what is happening, please call the health department at 262-605-6700 and press number 5. And immediately it will guide you to leaving your full name, date of birth, what date and where you got tested so that we can look up those results for you and help you there. So working on these issues to try to be able to get everybody tested that needs to be tested, and extreme apologies. It was a very unfortunate error, but we're working hard to correct it and get as many people tested as possible. In other news, you may have seen about the increased number of overdoses that have happened recently, and the health department is quickly ramped up with 2 Narcan trainings early next week. And we just want to make the community aware that we can do free Narcan trainings and give free Narcan out to those who are trained in order to help with our community who can be aided in the time of an overdose through Narcan injection. So there are trainings that are happening for that, and we can always do more online trainings, virtual trainings to help get that awareness out there. We are also working very hard on restoring some of our public services through our health department clinics. And this week we were able to start back up on our sexually transmitted infection testing. That's a urine test. We are working on how we can do that through appointments or by having people wait in their car until we can call you in to make sure that you're safe in our very small clinics, so that we make sure you have a mask, that we are masked, that we are abiding by social distancing. So we're working on these new processes and this new normal for our clinics, and we will slowly be ramping up some of our services there as well. One question I had received was actually, I've received it several times from businesses saying there's this new Johns Hopkins training to train people how to be contact tracers. And so businesses are looking to have people trained as contact tracers so they can essentially do this job if they get a positive within their business or their workplace. And while I think it certainly is a great thing for more people to learn public health and for more people to learn how to do contact tracing, I do just want to caution that it is only a health department that can place somebody in isolation or quarantine. And when we do contact tracing, we're doing so much more to find out about their signs and symptoms, to find out where they've been and who they've lived with, and are those people symptomatic. And so it is quite the disease investigation process. What businesses can do to help us is to make sure that they have proper lists of who of their employees have worked when, if at all possible, what customers have come to the business when, so that when the health department calls to say your business place might have been exposed to a positive last Thursday between 2 and 4 p.m., that the business is able to give us a list so we can contact trace those people. Part of the reason that we can't necessarily have businesses doing contact investigation is because the guidance changes daily. Just last week, it was flip-flopping with the CDC's guidance. So it's our job in public health to keep up with the latest guidance and making sure we're applying that to each case correctly. So just to avoid any miscommunications, that's where the health department certainly has trained up many people to be able to do this task, and we want to continue doing that in a proper fashion, but completely working with workplaces and businesses together so that we can help minimize the spread of COVID-19. I just wanted to end with, I talked a little bit earlier about how we are definitely seeing an uptick in people not taking COVID seriously, people who don't want to know their positive test results because they're afraid that they're going to have to be isolated for 2 weeks and they want to go to work. They want to earn money. But there's also the other side that have been very appreciative for our help. And I just wanted to read a note from one of our nurses who has been on the positive disease investigation team. And this is in her words. A gentleman I spoke with yesterday was very appreciative of all the teaching I provided him about precautions, isolation, and symptom relief. He was quite worried about having been diagnosed with COVID-19, as he said he took several measures to ensure that he did not acquire it. His anxiety was down by the end of the call, and I answered all his questions and informed him that he can call me back if needed. I asked if he had a thermometer in the home, and he said no, that he would have to find someone to bring him one. But when we told him that we have someone that could drop one off at his door with some masks, he was very happy and said, thank you very much. So these are the cases with a dedicated team at the Kenosha County Division of Health that is receiving dedicated, they're putting out dedication to the community and receiving good feedback as we educate people and walk them through what is a very anxious and fearful time. And we will continue to do that for as long as this virus stays around, and with all of our other communicable diseases that we mitigate daily through the health department. So I'm going to just check if I have any questions. And I have no new questions. So thank you all for joining again. Next week, I'll be back with what our future strategic direction is and the way we will continue mitigating this virus in this new future without the safer at home and through the summer and into the fall, and then with some more human stories that help to bring our Wednesday night communications to a close. So thank you very much, and please always reach out with any questions that we can answer either through email or publicly through this forum, and I look forward to talking to you again next week. Thank you.